Good morning, everyone. Today we will be discussing about the teacher. The topic that we'll be including today will be the roles and responsibilities, the function, the characteristics, the competencies, and then the qualities. So we'll be looking onto it one by one. So first, let's go to the terminologies. So here, when we say the word role, it simply means a function or a character or being a part of. So these are the characteristics and expected social behavior of an individual. And then when we say responsibility, it means taking in charge of something or having a duty to perform or taking care of one's duties. And when we say the word function, it is the action performed by a person or a thing for which it is particularly fitted or employed for. And then characteristics, these are a quality or a feature of a person, place, or thing that helps to identify, tell apart, or describe recognizably a distinguishing mark or trait. And then competence, it is our ability to do something efficiently. So a specific range of skill, knowledge, or ability that that comes under competence. And then in quality, it is a standard characteristics or a value that is needed to process or ongoing process of building and sustaining relationships by assessing, anticipating, and fulfilling stated and implied needs. Now, when we say the word teaching, it is concerned with the growth and development of the whole personality of the students. That includes the mindset of the student, the spirit, the spiritual growth, the character, and effective behavior. So teaching involves the growth and development of the whole of the personality of the student. So in a nursing point of view, we have a nursing educator. Instead of a teacher, we usually call a nurse educator, where the nurse is the one who teaches and prepares the licensed practical nurses and the registered nurses for entry into practice positions. So now coming to the role of a teacher or a nurse educator, here there are certain roles of a teacher or a nurse educator. First, we will discuss about the instructional role. So it includes instructional role, faculty role, individual role, and administrator role. So first we will see the instructional role. Here, as an instructor, we plan and organize the courses. Say for example, for the CBCS course also, before the classes was started, a planning was done, and then the course was organized. The syllabus were organized, and after that, creating and maintaining a desirable group climate, and then adapting teaching and instructional materials, and motivating and challenging students to pursue and sustain the learning activities. So this comes under instructional role. Then faculty role. Faculty means a staff. So as a staff of an organization or an institution, or maybe a dean or a member of one or more committees in a university or in a board of examiners, we can enroll ourselves as a faculty role. And then as a faculty role, we can play a role of counselor to the students. We can play a role as a researcher, as a resource person to outside groups, and as a representative to professional organization. And then we can also be a public health relation agent. So we can not just in the organization, but also we can, as a faculty, we can post ourselves publicly to associate the health, to let the community know about the health reforms and create awareness about health. Now coming to individual role, we have, as a teacher, we have a personal role as well as a teacher role. In personal role, we usually deal the student one by one. A teacher and a student interacts personally for the growth of the student. And as a teacher role, we play a teacher role in context of classroom teaching or providing education in a common context, in a common classroom. And last is the administrative role. which is the highest role performed by a nurse educator or a teacher. Here there is maintenance of records of the students' progress, the provision of reference for students, then as an administrator, one will participate in making timetable and then attending and contributing to all educational meetings for the improvement of the organization, then attending educational and social function as and when required, and then conducting different committee meetings. Now coming to the roles and the responsibilities. The roles we have discussed. Now coming to the responsibilities, we have first the socially responsible teacher. So here socially responsible means responsibility not only in the environment that we work, but also taking responsible in the society as a teacher. And then the second is teacher of high value and morality. When we talk about value, it means being worth it, being useful, and following certain principles. And when we talk about morality, it means correctness and virtue. So a teacher should possess value and morality. And then teacher manager identifies crises in terms of the environment, in terms of the teaching environment, and in terms of the student. And then uh, teacher a teacher is learner centered, meaning that a teacher is concerned with the learner. A teacher teaches teaching revolves around the learner. And then openness of a teacher. A teacher is welcoming and always approachable, and the teacher is always accountable for what she teaches. And then a teacher maintains professionalism, and then a teacher comes with their best talent. And then a teacher is a good communicator, meaning a teacher should possess a good communication skill. And then the content to be taught to the students should be well managed. And then the qualities of management, the teacher should know the qualities of a manager. That includes maybe some of it are like being an advisor, being a counselor, or being an educator to the students. And then a teacher should have leadership quality that is almost same with the managing qualities. And then nursing teacher is in progression. So when we say nursing teacher in progression, as a teacher, learning doesn't stop there. Therefore, a teacher is always faced with an opportunity and should always take the opportunity to improve oneself. So that is our responsibility. These are the responsibility that we should perform as a teacher or a nurse educator. Now coming to the functions of a teacher or a nurse educator, it involves giving explanation, information, initiating certain activities, directing and administering certain activities, and then administering the curriculum, the syllabus to the students. And then a teacher should function to unify the students, the groups, and then giving security to the students, security in terms of safety. And then the students should be able to rely on the teacher. And then as a teacher, we should function to clarify the attitudes, beliefs, and problems of the students, and then diagnosing the learning problems of the students, which may be learning problems like inability to understand, or a student having problem in seeing or hearing or processing the facts that has been provided. And then making curriculum material, and then evaluating, recording, and reporting the students' performances, and then enriching community activity. So in nursing point of view, we always go for community outreach to help to maintain a public health relation. And then we also have arranging and organizing classroom. A classroom should be organized in such a way that it is conducible to conduct the teaching. And then participating in educational institutional activities. So a teacher should function to involve oneself and the students in performing curricular activities as well as extracurricular activities.